Ascites or water belly. Ascites is a multifactorial syndrome caused by interactions among environmental, physiological, and genetic factors, which is manifest the excess amount of ascitic fluid accumulate in the abdominal cavity. This syndrome of broiler chickens that can occur worldwide. Ascites is associated with inadequate supply of oxygen, poor ventilation, and respiratory disease complex aetiology. Morbidity is usually 1-5%, mortality 1-2%, but can be up to 30%. Aetiology. A combination of factors leads to ascites. Environment, ambient temperature, high altitudes, stock density, air quality, nutrition, diet density, feeding type, disease, virulent or bacterial infections, mycoplasmosis, colibacteriosis, etc. Genetics events. Genetically, the modern broiler, especially male broilers, seems to be more prone to develop ascites. Pathogenesis. The primary cause of ascites in meat-type chickens is right ventricular failure as a result of increased pulmonary and arterial pressure. When the workload on their heart and lungs is increased, a chain of events triggered that leads to reduced levels of oxygen in the blood. In the initial stage, this can be detected by slight darkening of the comb and wattles. As the disease progresses, fluid leaked from the liver accumulates in the abdominal cavity. Eventually, this restricts breathing and ultimately in this restriction that leads to death. Clinical signs. Mortality from ascites is greatest in birds at the end of their rearing period at about 3 weeks of age. Since growth stops as ARV feed develops, affected broilers may be smaller than their pen mites. High rate of panting is often observed in ascitic birds because their abdomen is distended with fluid. Birds which are ascitic may show signs of cyanosis of the comb and wattles, dullness and or depression, abdominally slow heart rate and or red abdominal skin with congested blood vessels. Autopsy. If their belly is opened, a cup or more of fluid or gelid material will pour out. Lungs of a ascitic bird may often appear pale or grayish. Lungs are extremely congested and edematous. Liver enlargement is often seen. Thickening of right side myocardium and dilation of the ventricle are very common. Microscopic finding increased cartilage nodules in lung. Sometimes birds die from the effects of too much blood and fluid in their lungs before there is any significant amount of fluid in the body cavity. In this photo you can see fluid accumulation in the pericardium. You can see in this photo fluid accumulation in the abdominal cavity. Control of ascites syndrome in poultry. Environmental temperature, humidity, and air movement should be controlled to prevent excessive loss of body heat, particularly in the early neonatal period. Even brief exposure to cold stress during the first weeks of life is known to predispose flocks to this condition. In this photo you can see the modern Warren's gas analyzer for poultry house. It is now common for company advisory personnel to have these instruments for spot checks or sharing with producer to trouble a poultry house environment control system. In conclusion, I would like to note that it is necessary to always monitor the microclimate. Remember that prevention is always easier than treatment.